having trouble hearing me, but it's my pleasure to introduce Professor Kittiyod Poovorawan.
Hi.
Go ahead.
Hello, everyone. Okay, now I would like to share my slide. Can you? Okay.
Great.
Okay.
Thank you. Please proceed.
Okay. Good. Hello, everyone. Can you hear? Can you see the slide clearly?
Yes.
Okay. Okay. Thank you. And hello, everyone. Okay. Now I will talk in aspect of the Thailand about the hepatitis C elimination program in Thailand. Thailand is the 70 million population country that have quite a challenge because in Thai majority of population is in the rural areas, and in Thailand we have like a lot of immigrants that would be both legal and illegal immigrant population in Thailand. So it's quite the challenge situation. About the epidemiologies, about the prevalence of hepatitis C infection, if we look at the new blood donors each year, we can see that the prevalence is decreasing over time, like from 2% in the past to recently, it's around 0.4 to 0.5% among the new blood donors. And recent national surveillance data in Thailand, they found that about 1.2% of the overall population will have the anti-HCV positive. In this group, in male is more than females, and most age that have the highest prevalence is around 30 to 60 years of age. It's around 3% in this age group. In last previous several years, we have done the mathematical modeling study to estimate the prevalence and the morbidities and mortalities related with the hepatitis C in Thailand. We, in this modeling, found that the prevalence of the hepatitis C will decreasing over time without any intervention. But based on this modeling data, it showed that the decrease of the prevalence is because of the new incidence is quite low, but the decreasing number is because of the mortality related with the hepatitis C. So that is not a good thing, that most of them will die later on. But with the increased treatment coverage, it will show the significant decreasing in the number of the deaths related with the hepatitis C, as you can see in the right figures, and also decrease the annual incidence of the hepatocellular carcinoma. We can increase tenfold treatment coverage compared with the past time. And what about the Thai public health done to trying to eliminate the hepatitis C? The Thai Liver Association make the guideline for national policy for treat hepatitis C that compatible with the Thai public health facilities, and also the Thai Ministry of Public Health published the guideline focusing on the eliminating of the hepatitis C that tied to aim as the goal of the WHO aims. And what we have done about the medication in the past, as we know that the hepatitis C drug is quite expensive and widely unavailable, especially in the rural areas. So the thing that have been done to increase the access to the antiviral drugs is to add the pan-genotypic HCV treatment regimen, that the one that used in Thailand is the soft wells, into the national list of essential medicine. It will make the all hospital can access to the drugs in the national drug list, and also remove some barriers to reimburse this treatment, because drug in this, the Thai universal coverage can reimburse it for free, but they have some criteria. In the past, in Thailand, have one problem about the fibrosis criteria. In the past, they limit only one with significant fibrosis. It means that they're free for only one that have the more advanced liver disease. But nowadays, this criteria already removed. It means that all anti-HCV positive can reimburse. And another thing is about to try to minimize the drug cost. Even in the last 5 years, the drug cost is decreasing to around $1,000. with the generic drug from many companies. But now in this year, the Thai FDA have tried to make the drug by themselves, and the drug cost is decreased to around $200 per course of treatment. So it will make it more widely available and affordable. And about the free reimbursement criteria, they try to minimize criteria. In the past, they need to do the genotype. Now, this criteria is removed, and also the fibrosis criteria is removed. Apart from the treatment and the drugs, in Thai, we have some group from the Professor Yo that try to do the micro elimination in some high endemic province. This is one example of the Phetchabun province. This is one of the 76 provinces in Thailand that have really high incidence of the hepatitis C. The prevalence in this province, based on the survey data, it shows it's around more than 6% of the whole population. It's quite almost 5 to 10 times than the usual population. In this study, they try to make the feasible way to the diagnosis and treatment in this province that have quite a rural area. In that communities, in every community, they will have the primary health setting that have a very minimal healthcare facility. They try to do the rapid test, the screenings, and one that have the positive test, they send the blood to the higher level of the healthcare facility to confirm the INA testing. And one is positive, they have the well-trained physician that to prescribe the medication and deliver the medication. As in this picture, in this project, it will universal screen everyone in the province actively that the age more than 30 to 65 years. I will show you some the preliminary data about this screening program. And as you see in this province have the registered population is around 1 million, and the one that have the target for the screening is around more than 300,000 populations. And the actual number that this project can screen is around almost 90% of the population in the whole province. That's quite a large numbers. And about the positive test in the serology test with the rapid test is around 5%. Among these that have sent the confirmation test, it shows that around 73% have the positive INA testing. And these positive cases, they move into the treatment cascade. As you see in this number, because in last few years, the COVID era, it have some delay in the treatment in this group of population, but now there are more and more cases come into the treatment. As you can see that now it's around more than 70% of them have already achieved into the treatment cascade already, but some of this population did not receive treatment. You can see that in the right hand, about the 70%. There was some case they might refuse to treatment. They don't want to treat. Very few of them is my loss to follow up. And another one major thing is about there is not fit into the criteria of treatment by the physician judgment, or even there is not fit in current reimbursement criteria. Because in Thai we have some criteria that, in my opinion, in the future it should be minimized, such as the case with the active alcohol drinking, they not reimbursed for them, something like that, or the case that have some comorbidities that they seem to not benefit much on the treatment, they did not reimburse to them. So that is one limit problem that I think that should be decreased in the future. And another things, in the prison in Thailand, we have the campaign of the screen all, treat all. This is already implemented in many prisons in Thailand, that they screen hepatitis C, hepatitis B, HIV, and syphilis screening. And in hepatitis C, they treat them all. Such as example of one prison in one province. They screened around 3,000 prisoners and found around 70 positive, and they treat them all, something like that. And another thing, in this year, the Thai government has started to universal coverage program to include one-time screening for hepatitis B and hepatitis C for free to those that born before the 1992 or the one that 30 years of age or elders. They will have free reimbursement for one screening in the right time. And they also include the yearly free screening for those with the higher risk groups, such as those with the HIV, IVD use, MSM, or men who have sex with men, or the healthcare personnel and the prisoners. They have yearly free for reimbursement the cost of screening. And another thing that Thai Liver Society try to do is to increase the awareness. I think this thing is the major problem in many countries, that most of the population did not aware this disease at all, or some population did not know at all what is the hepatitis C. So they try to make the video on the social media, in both the funny videos or most of the like the heart catching, and show the importance of this disease and how it causes morbidities and mortalities, and also emphasize that it now is free for screening and free for treatment. So to make the more population come into the hepatitis C treatment cascade. But there are some limitations and many future challenges in the Thailand situation. In Thailand situation, we have the registration system, but mainly it's registered based on the reimbursement drugs. But we don't have the like the active real-time monitoring about the prevalence, about the new infection or the treatment, the drug that not reimbursed. Sometimes we don't know the exact number on those cases. And about the simplified test to treat strategy for hepatitis C is implemented in some province that try to do, like in Phetchabun province. But in many provinces that might not have good enough to do that cascade, such as in some primary care hospital in rural area, they might not have the link to send the INA confirmation test, something like that, in very like the rural areas. And also in Thailand, the reinfection can occur in many groups of population, such as in the MSM that have IVDU. In that group, many of them have the several episodes of infection even after treatment. And also the screening program is now free. The treatment is free on criteria already, but it's still passive. It means that most of them need to visit the hospital by themselves. Like the active screening that some healthcare personnel go to into the communities, it is not widely implemented, just only in some areas. Okay, that's all about the pictures of the hepatitis C elimination in Thailand. Okay, thank you very much.
Thank you very much. Excellent overview. So much information. I greatly appreciate it. You really gave us a good overview of the new universal screening program and removing treatment and testing costs as a barrier for patients. So congratulations to Thailand for bringing that about. And you touched on, and partially answered a question I had, which was, how is that testing recommendation getting rolled out and getting adopted? Because at this point, it's all about testing, right? I mean, that's the only way to find the treatment, people that need treatment, and get them on the treatment. So, with your experience in other nationally supported screening, perhaps for colon cancer, for example, or breast cancer, what do you think is needed to roll out this universal testing recommendation so that it will be adopted by primary care clinicians and others? Do you have any ideas, please?
Yes, because this implementation it needs a lot of effort because now the public health policy is only free for testing, but the way to implement this free testing is quite challenging. In my opinion, I think that each community they should have some like the public campaign to enroll those in the communities to get tested. But I think it might be in different way based on each community, something like that. But at least the first key have already started that it's free. But the implementation, I think it's quite much challenge on that. Yes.
Okay. And quickly, we heard about the benefits of reflex testing in Korea. Is that type of strategy done in the laboratories in Thailand?
The reflex testing is not done routinely. It still need the way to request further confirmation tests. But in the campaign or in the implementation, sometimes they have like the flow to do like the reflex testing. But in general, primary care they still need to request another testing to confirm.
Okay, thank you. And there was a question in the Q&A section about testing in prisons. And is that a ongoing program, meaning as prisoners come in, they are tested? Or is that a program that was only done for a study or is only done, at certain times?
In several prisons, they done like the routine practice already. It means that all new prisoners they will screen all these infection. But now it's not implemented in all prisons in Thailand. Just some of them. But by policy, they try to do it all.
Yeah. Well, it's off to a great start. Thank you very much.